welcome this evening to the Personalized Lifestyle Pearls on behalf of the Metagenics Institute. Really wonderful to have our guest, Dr. Paul Thomas, with us this evening. And if you don't know who Dr. Thomas is, you really need to. He is an integrative physician and an addiction specialist with a thriving clinical practice in Portland, Oregon. It truly is thriving. In fact, he has his own YouTube channel where he features videos from his clinic, and you can see some of the work that he does with children. So welcome, Dr. Thomas, to the Personalized Lifestyle Pearls.
Oh, thanks, Deanna, for having me on. It's a real privilege.
Oh, it was, I was so glad to see that you were on the schedule to come on and talk with us, because the topic that you're going to talk with us about is very relevant in this day and age. In fact, I was just looking through my literature reviews and my alerts, and just this morning I had a paper that came through that was just published a couple of days ago on September 14th, talking about an association between school lunch consumption and urinary phthalate metabolites. So in other words, kids that are eating school lunches are becoming more toxic with all these plastics, these metabolized plastics, and this is causing a lot of issues.
Absolutely.
So we're going to talk about toxicity. Yeah.
Yeah. So you're like me. You're poring over the literature every day. I just didn't get to it today, so you beat me to that one.
Well, you've done quite an extensive literature review, and your books and your work really reflect that. So where do we start? You know, maybe we go back to talking about in utero, and where a lot of these perhaps endocrine disruptors, these different toxins that are in our environment, really begin this process of disruption in children.
Yeah, that's where I like to start, Deanna. If we're going to talk about toxins in children and what is causing the chronic health issues that we're seeing. So for our viewers, you know, if you're dealing with children in a healthcare capacity, that our children are sick today. It's not like it was 20, 30 years ago. We have almost 50% of kids graduating from high school with a chronic disease that requires some medication. That just blows my mind, because growing up, I think I knew one kid who had an inhaler. And now we have autism's 1 in 45, ADD, ADHD's 1 in 10, asthma 1 in 12, and neurological disease in general, 1 in 6 kids. What is causing all this distress? It's toxins, which is the big thing we're stressing and talking about today. And I like to start at my prenatal visit. I've got a young couple. They're sitting on the couch across from me, and I do this almost every day. I have a new couple joining my practice, and we say, all right, you're the environment, right? So the genetics is already predetermined. We can't really do much about that, but the environment, and mom's sitting there, and I tell her it's not your fault. If dad's there, you know, the partner, whoever that may be, we're just as toxic. So I'm not picking on you, but what can you do? So food, what you eat, make sure it's organic, if at all possible. It's fresh, it's real food. It's not coming from a factory. There is nothing more important than the food we eat. And then there's nutrients. There's certain nutrients that are very hard to get adequate from the diet, vitamin D being an example. So a lot of people struggle getting enough omega-3 fatty acids. There's another. Many people don't get enough B vitamins. If you're a vegetarian, you probably need to supplement with B12. And there's some people genetically need methylated B vitamins, whether it's methylfolate or methyl B12, for example. So there's your nutrient piece. And then the next big thing I stress is that thing that just interrupted me, which is the cell phone, or basically reduce stress. Because I'm actually going to turn it off. I'd forgotten to do that. We're animal kingdom creatures, folks. So I am an animal wired to scan for danger. And so are you. And so is that mom who's pregnant. And when that cell phone alert goes off, it pulls your attention, and you get this tiny little fight or flight bleep of hormones. And you do that all day long. And we'll talk about kids and screens, and we're talking about a disaster to the stress levels of stress hormones. So anything you can do to reduce stress. We talk about sleep and exercise being vital, and then your community being so important. So that's where I start, because if you start in the womb and you get off to a healthy start, at least you're off to a better start than if you're not, right? And those phthalates, that article you're talking about, plastics are hormone disruptors. We know they're not good for brain development. So on many, many levels.
That's very well said. And you just addressed a number of different toxins that are in the environment that people are exposed to even before conception. If I think of all the different toxins that are out there, you were talking about food, you talked about technology. Let's maybe just go through a quick list, because I do think that if we're looking at the extent of toxins, then we can easily find some solutions, whether it's avoidance or things that we bring in. So
Right.
you mentioned technology, you mentioned food. What about personal care products? I think that especially with women, this seems to be a concern.
Yeah, there are a lot of toxin hidden in personal care products. Heavy metals are an issue for some products. Deanna, you probably, being that you use these, you probably are even more versed than I am on which things you're most worried about. Like, why don't you share with me just momentarily the things you're most concerned about in personal care?
Well, it's interesting that you say that, because even though women tend to use a little bit more in the way of personal care products, men are not that far behind. So when we
Well,
talk about
we
personal
have
care
those
products,
antiperspirants, right? So I'm
because
guilty for.
it's toothpaste, it's soap,
Mhm.
it's shampoo, deodorant. I mean, let's just talk about deodorant for a second.
Deodorant's
And
big.
all.
Yeah, the
Mhm.
aluminum in deodorant, folks, it's the antiperspirant, and some of it's absorbed. And aluminum, we know that it's bad for your immune system, and it's directly neurotoxic. So it hits you on two different levels, stimulating autoimmune problems and then direct neurotoxicity. That's not a good thing, folks.
It's so true. And then even if I think about children and some of the other toxins that they're exposed to, so I just, for some reason, I keep coming up with plastics. I think of the
Yeah.
plastic toys. I think of the plastic packages that foods are in. Fortunately, you can buy baby food now that it's in different containers. I'm
Mhm.
not sure how I feel about those pouches, because I think about the liners of
Yep.
those pouches.
Yep. And when
So
something's BPA free, they're replacing BPA with some other plastic that's just less well tested. Mark my words, we're going to learn in another few years or a decade or two that what was used to replace it probably is not as good as we thought. Yeah.
well, you're actually
Fluoride
very.
is a problem too. So
Mm, mhm.
they add fluoride to water because of some studies showing it decreases cavities, but it also causes neurotoxicity. It's a neurotoxin. Studies have shown that to be the case. So it's a tricky one as far as should you be swallowing the fluoride. If it's just on your toothpaste and you're spitting it out, it's probably fine. It's probably going to help a little bit with strengthening the teeth and reducing cavities, but I would be very cautious about ingesting fluoride.
Yes, definitely. So another thing, I want to just go back to what you mentioned about the bisphenol, because I do think that there is some literature now showing that BPF and BPAF and even BPS, there are different forms of these bisphenols. And
Yeah.
your comment is actually very prescient, because there is already literature suggesting that some of these other bisphenols are even
Mhm.
more toxic than BPA. Yet we
Yeah.
see all these products for children that say BPA-free bottles.
Right, right.
So do you give your patients like a list of some strategies, just in terms of like glass bottles? Do you talk about diapers? Do you talk about, all the things that infants and children would be exposed to? Are there some basic strategies just right out of the womb? Like if we're transitioning now from talking about in utero
Yep.
to talking about
So
the womb.
so now you have a newborn and breastfeed,
Yeah.
please, breast, right? Because I have heard that cow's milk is for calves. Pretty sure that's true. Um, and then of course how you deliver that. If you're hardcore and you can do a glass bottle and minimize the exposure to plastics, how you heat that milk if you're warming up, whether it be breast milk or formula. These are all important things. Again, once you start eating real food, whether you're starting at 4 or 6 months, that it's organic. I mean, please. And I don't like those plastic pouches. My patients come in with them quite a bit.
Mhm.
And then for snacks, I mean, there's such a difference, even in my practice, which is sort of here. I'm in Oregon and we're supposed to be granola, crunchy, all aware, but there's the whole spectrum of parent who comes in. Some have got just total junk food. Fishies, they're not the fish that swim in the ocean. They're these little crackers. And I mean, that's just junk, right? Processed food. And then you have another parent comes in with a little container with all cut up fruit and nuts. And it's just like, well, not nuts for a little baby, but you know, healthy, real food snacks. That's so vital, so important. Again, back to real food.
Back to real food. I think that that is really the essence. And that's where we start, because if we fortify our bodies with those nutrients, it's almost like a lot of these toxins can be overruled, and we won't have that same toxicity that can come into play. And there's good scientific literature on that now, showing how nutrients can buffer the effects of toxic exposure.
Right.
So
And so besides your nutrients from food, it sometimes is worthwhile thinking about nutritional supplementation. It's just, as
yes.
I mentioned, the vitamin D. Studies are showing that you can supplement moms while they're pregnant, and this is actually good for the baby's brain development and for their immune
Mhm.
system. You can give a newborn 1,000 IUs of vitamin D3, and this is very, very helpful. And then as soon as they're old enough to supplement with some other things, that's something to consider. But in the meantime, if you're breastfeeding, then mom, you make sure your nutrition is as complete as possible. And if you have any deficiencies, you get those addressed. This is where I know individualized medicine is a real thing, folks. It's exciting. You can do genetic testing and understand that perhaps you have a glitch. I happen to have the MTHFR. A couple of my kids have it from both parents. They don't methylate well. They need methylfolate. And I didn't know that for the longest time. So knowing that today, if I was having a kid today, I'd find out right away and do some things to kind of support them nutritionally and as needed with specific nutrients.
Yeah, so let's go back to that, because there are so many different supplements that people can be on, and that can get very overwhelming.
Right.
So what are some just general, I usually go with the number three. What are just three basic supplements that most mothers can be on, especially if they're nursing? You just mentioned fish oil. What are your thoughts on probiotics?
So probiotics, vitamin D, and fish oil would be top three. I really
Okay.
think these are things that are going to boost your immune system. If you need extra support for oxidative stress and getting rid of toxins, then we've got the antioxidant group of supplements.
Yeah, absolutely. That's a really good point. And do you run SNPs or gene tests on your patients, on the parents of the child, just to see what they might be in for, and different things from that they can then tailor their supplements to?
So that's a confession. I'm not meticulous at every parent and pushing them to do that because financially it's a little bit of a stretch for a lot of people at this stage, and I don't want to overwhelm them. But
Sure.
anybody who's got the means and is willing, absolutely get that genetic
Mhm.
testing done, whether you do a cheek swab or you do a spit test. There's a number of companies that will run either a simple screening for a few things or a comprehensive one, and then you can go down that path of trying to individualize things. Absolutely.
And I think that there are several interventions that we can make without needing to do genetic tests. We don't have to make it complicated. So you
Exactly.
mentioned methylated B vitamins. I mean, B vitamins are very inexpensive. We
Yep.
need B vitamins as cofactors for other reactions in the body. So we're really hitting on all cylinders if we just take something as simple as a B vitamin. We have a question, Dr. Thomas. It says here, you spoke about devices and the impact of them. Is there anything we can nutritionally support to reduce the impact? So here we go back to technology. We'd go back to iPads, or
Mhm.
just any kind of screen technologies of any types. First of all, what can we, I mean, probably avoidance is first and foremost, right?
Yeah. If I can digress before answering that and then bring me back to the question, I've got to share a story because it
Mhm.
highlights the value of prevention or at least removing the offending toxin. So, this is a story of a 16-year-old girl in my practice who arrived severely depressed, suicidal, on two medications from her psychiatrist, not able to get out of bed to go to school anymore. She was just flat affect, not quite catatonic, but pretty severe. And I'd known her since she was a baby. She was from a family they were athletes. She was an athlete, great student.
Mhm.
Something tragic had happened. And long story short, I'd made a minor adjustments, suggestions about diet. We're going to reduce one of your meds a little bit. Let me see you back here in a month. She comes back perfect, happy, cheerful, like, wow, I've never seen that kind of a transformation.
And you said that was after 1 month.
After a month. I've never seen
After
anything
a
like it.
month.
So I'm asking her, what happened? What's different? Oh, I don't know. You reduced my medicine a little bit. I'm going, no. There's something else happened. What happened here? The mom goes, remember, honey, you had a head injury right after you left Dr. Thomas's office and you were on brain rest. So she had had a month of no screens, no school, no TV, no friends, total brain rest. It cured her ADD, her anxiety, her depression, everything. She was like back to normal. I said, well, how much time are you spending on your screens? It was her phone. Oh, a lot. I said, well, how much is a lot? Well, probably too much. How much? 7 or 8 hours a day. Now, I just
Mhm.
read a study where the average child spends, I think it's now 11 to 12 hours. That was one study. Another one, it was 7 or 8 hours a day. That's on school days, folks. The Pew Research Institute just published their 2018 document, Teens, Social Media, and Technology in 2018. And they
Mm.
say that 45% constantly on some kind of a screen. That's the amount of, remember, we're animal kingdom creatures, and that's that constant fight or flight, stress, stimulus. Realize at that moment that you look at that screen, but it's constant. And so brain rest, removing the offending toxin, in this case, it's actually the screen that's the toxin, is number one and vital. Next would be you've got to support your, antioxidants. So we're talking whether it's glutathione, it's omega-3 fatty acids, your fish oils, your vitamin C. Um, there's others, but those are kind of big ones to support your ability to get rid of toxic stress.
Thank you. That really does put it into a fuller picture. And having that example with this patient, it's just amazing. Like if we did get some downtime away from technology, it would be very beneficial. But is it a reality? I mean, if you look at kids today, I think somebody was just telling me that they're now making signs, street signs, a bit shorter, so that people that are on their devices can actually look up at the street sign as they're crossing the street, so that there are no safety issues. I
Yeah.
feel like our society is trying to accommodate these changes in technology.
Yeah.
So is it really realistic to tell our kids that, no, you need to be off your device? Do we not create a bit of a schism or a rift here between kids and their friends, their communities? What is actually the age that you think is appropriate for, number one, a child to have a cell phone? And number two, what do you say to parents about gauging their time on social media or Snapchat or all of these different these platforms? What do you say? I
Yeah.
mean, what's the right time?
So no screens at all under age 2. The Academy of Pediatrics has been clear about that. Lots of research that shows that is just detrimental. I'd say the longer you wait, the better, right? I raised 9
Mhm.
kids, and I was in that era where kids having cell phones was just exploding. And so everybody wanted one because that was the new thing. And now I think it's more just accepted that your child will have a cell phone. And parents, if you've got both parents are working, that example I gave of that child who was, struggling. I mean, you think about the fact that, maybe 1 in 6, 1 in 10 kids are struggling neurologically. If it's depression, anxiety, ADD, focus issues, you name it, you're harming them so much if you're allowing them to have just unlimited access to this toxin of the screen. But you've got to understand that that's what it is, or you're not going to do anything about it. So I think that it starts with understanding, and then you've got to figure out a way to help your child understand it so they realize there's real benefit to putting it down, because they really truly become addicted. I mean, in the book that I wrote on addiction, in the summit on addiction I did, it is such a big piece today. I mean, we're used to alcoholics and heroin addicts being, that's the addiction. I think the biggest addiction that's just rolling over our youth and young adults is this screen thing. And it's doing the same thing. It's simulating that dopamine response, and you can actually have withdrawal. So that kind of brings it right up to that. It's a true addiction.
Dr. Thomas, thank you for mentioning this aspect of addiction, because even when you and I spoke about addiction, when you came to my house and we had that great conversation, one of the things that we talked about was how there's something deeper that underlies addiction. You just talked about a neurotransmitter effect, but
Mm-hmm.
what about a life effect? Is being on our device 24/7, having it by our beds, our children are now having these devices. What does this say about our culture? What is the
Yeah.
actual like the underbelly of all of this. What's
Yeah.
at the roots? Let's do functional medicine on this
Right.
addiction.
Right. So the functional medicine things we can do, which includes fixing the diet and fixing the nutrients, and all those things are so important. But the other piece, and we touched on it when we spoke together before, is the thing about your community, having a healthy community. I go back to I think it was the 1980s, and Canadian scientist Bruce Alexander, I think, did the rat park experiments. Rats in a cage given opium or water will choose opium and can even drink it until they die. You take that same rat and you put it in this gorgeous park where there's places to hide and mate and play and have playmates. They will stay away from that morphine no matter what, stick with water. Even if you got them addicted first and then put them in the park, they're fine. It says to us, animal kingdom creatures, that we are humans just like rats. We need community. We need a sense of healthy, nurturing community. And it's interesting. We're duped into thinking that screen time is community, but it's somehow not the same. It's actually very isolating. And most of the studies that look at this are finding that to be the case. The more time you spend on screens, the more depressed you are, the more anxiety you have, the less you're able to sleep. The studies are just pouring out on all of this. And that's another stressor that I hadn't touched on, but lack of good restorative sleep is a big one.
Yes, and even the blue light exposure, right?
Yes.
So having that saturated, enriched blue light late at night changes our circadian pattern by changing melatonin. And so that's incredible. So maybe one preventative thing that we can do with kids is to change at least the screen setting, the coloring, the lighting. And there are certain things that we can do in order to do that. We can reduce the intensity of the screen, the brightness. You probably would want to share some programs or some easy setting changes that we can make on having a warmer screen rather than a cooler, bluer screen.
Yeah,
Even simple things like that can help.
Yeah, that's a good point. And there's nighttime settings, for example, so that it's just a different glow and it's not as intense. Those are important things. But also, first of all, you've got to model living without it, and that's difficult. Right? Even the adults in our world now have become dependent. I was driving to work the other day and I'd forgotten my cell phone. Guess what I did? I made a U-turn and went back home for my cell phone. That's nuts. It's like it's almost as important as oxygen or my wallet. And so we've got to model no screen time Sundays, or time where you just turn it off and you go to the park. There's a real difference if you experiment with this. If you're somewhere where you can look off in the distance and there's trees or mountains, and just look at the mountains and trees for a little while, and then bring your attention back to your screen and feel the difference. It's a totally different experience, and we need to get outdoors. We just not getting outdoors enough anymore. So if there's any opportunity to do that or to encourage that, if you're a provider taking care of patients, it's really, really big.
That just made me think of something, and it really gets back to cultural anthropologist Angeles Arian, who talked about spending at least 1 hour outside every day to make that your requirement. You can do whatever you want outside, but you've got to be outside. You've got to feel the earth. You've got to be walking, be running. You just have to be out there and breathing the air, just, I think, everything combined. And that's the whole science of forest bathing, really being out there in nature, even if you live in the city.
Yep. Find a park.
Find a park. Yeah.
Or at least get outside and go for a walk. It's amazing what these little things can do. But back to screens, with the severity of the problem, folks, you have to be intentional, right? This isn't something that your kids are just going to put down. You're going to have to really be intentional about how you're managing screens. And I know that I'm reading and learning that a lot of the Silicon Valley people who make apps, so they make these things to be addictive because they need sales, right? There's in-app sales. So the whole thing is engineered. They don't let their kids have cell phones at all. Most of the people who are making these apps, they know what they're doing. And so we've got to be a little smarter ourselves as consumers and just go, whoa, wait a minute here. This is not good for us.
As you're describing this, it sounds reminiscent of even the food industry in some ways, with a lot of these high sweet, high salt, high flour type products, a lot of processed foods. and how addictive that those can get. And I'm curious, I don't think that there are any studies on this, but I'm curious about what you see in the clinic. If children are on technology devices and rewiring their neurochemistry, I wonder if they're more prone to cravings and to going towards things that are sweet because they're not going to be as engaged in their environment and actually sitting and taking the time to eat. They're probably eating while they're on their phone and not really in touch with satiety or hunger signals.
Well, we know that's true. If you're sitting in front of a TV or any screen, you're not paying attention to what's going in your mouth. But Deanna, what I think actually is happening is the other way around. Our kids are learning the little reward system of sugar, of processed foods, that quick hit that actually is a little dopamine hit as an infant when you're eating those junk foods, those pouches that are sweet, fishes that they eat, the crackers, all the high fructose corn syrup stuff, right? And the artificially sweetened stuff. They're already conditioned now to get this little hit of dopamine from food. And then they get this a similar sort of response from their screen in a strange way. So the addictive cycle, if you want to call it that, that reward cycle, that it just perpetuates.
It does, yeah. It's so true. And so we have to break the cycle through nutrition, through downtime, through family time, through community time.
Yep.
We've got a number of people who are on here with us, and I am wondering if anybody else has any other questions for Dr. Thomas before we close our session tonight. We did have that question before that I think we answered about devices. Stephanie was asking about 23andMe, and I think that you addressed that to some extent about not everybody having the financial wherewithal to kind of go through that whole process of genetic testing and maybe not even the time.
So the specifics on that one is it is just a spit test and you can order it on your own, which is kind of nice. And then the raw data file that you get, you can run through a number of various programs and get some more detailed information about your specific SNPs, your specific single nucleotide polymorphisms. So that is definitely a way to do it. There's many other labs now that will give you panels, or even just if you want to get an MTHFR, you can get it on saliva or blood. So there's a number of ways to get to that genetic information. A lot of doctors who work in the psychiatry field are offering panels that are looking at how you metabolize the various drugs that are used in psychiatry, because they want to make sure they're not picking a drug that you don't metabolize well. And that's fine. It has its role, especially if you need to be on medication. But remember, as a functional medicine, natural healing person or provider, we don't usually want to rush to medication. We want to treat you holistically by figuring out what's the underlying issue, and then what are the solutions that we can do naturally. And it always starts with food and removing toxins. At the cellular level, are you missing certain nutrients? There's a number of tools we have as functional doctors and physicians, providers, that we can sort of drill down and figure out what specifically you need that's relating to the symptoms that you're presenting with, not just treating symptoms.
Yes. Thank you so much. This is, it's been inspirational as well as informational. I feel like you've provided us a number of different tools, a number of different things to think about, and strategies to help our children with technology. My biggest takeaway here is, it starts with us. It starts with us as adults and modeling this behavior, because otherwise, we can't expect our children to do something different. Yeah. So any closing words for our audience before we sign off from our discussion?
Well, you love your children if you're a parent, you love your patient if you're a provider, and don't be afraid to do the tough love when it comes to things like toxins in your child's world or your family's world or your patient's world. Help them see what it is that they're exposing themselves to that they can maybe do something about. And don't forget this issue of screens. It is the big toxin that nobody's really talking about or becoming serious about. We've got to get serious about this. The mental health, the sense of well-being, all of the connectedness that we need to be, happy humans, is being interfered and harmed by all the screen time. So takeaway message, I'm sure it's let's do a lot less screen time as we talk to you on the screen. It's really
We have to
great to
start
have you.
modeling that
I
even
know, right?
here. You know,
It's really
I
great. Well,
know.
you know, that parents will tell me that it's like, well, they have to do their schoolwork on the screen. And obviously, right? I mean, Deanna, you and I do a lot of our work on summits and on online consults, etc. But take that time off. I know you go and
Yeah.
walk in the forest that's right outside your house, and any opportunity you get, take the opportunity, make that appointment with yourself, with your child, with whoever it is that needs that help getting away from screens. Oh, I'll close with one example. So for Father's Day this year, I made the rule. I called all my kids. I said, I'd love to see you, but there's only one condition: no phones this Father's Day. And,
Oh, what a great
and,
idea.
and you know what? One of them, who's addicted, said, oh, I've got this work commitment. This is a Sunday. I've got this work commitment. I'm going to have my phone. I said, oh, I'm sorry. You're not going to be able to come then. But, you know, if you can work it out. And he didn't come. The rest of them came and left their phones behind. And we had the best Father's Day we've ever had. And they all agreed. They said, we've never had so much fun. People were talking to each other, meaningful conversations. In the past, everybody's on their screen and texting each other across the room. I mean, it's
Oh
just
my
nuts.
goodness.
It's just nuts. So it really works to implement some no screen time and add the quality back into your life and into your relationships. It's amazing.
Dr. Thomas, thank you so much. Words of wisdom. And I really like your example that you're setting forward to your 9 kids. So of anybody, I'm sure that you're going to be the trendsetter for us, and we'll be looking to more tips, more tools, more practical ways to help children. Thank you so much. And I hope to have you on again.
Thank you, Deanna, for having me, and blessings to all who are watching. It's been my privilege and a pleasure.
Thank you. Take care, everybody. Good night.